My name is Agatha Jarab Kimayu. I'm going to take you through a video on micro-teaching session video on clinical handover communication using the ICEBA framework. As future registered nurses, you will participate in thousands of patient handovers through your career, making this skill absolutely critical for patient safety. Today's learning objectives focuses on the ICEBA framework because structured communication has been proven to reduce medical errors significantly. By the end of this session, you will confidently use the systematic approach during shift changes, patient transfers, and emergency situations. These objectives align with our nursing program's communication competencies and prepare you for the real-world clinical practice where each clear, concise communication can save lives. So our learning objectives are: demonstrate effective ICEBA communication during clinical handover, prioritize critical patient information for safe care transitions, apply professional communication standards in clinical practice, and finally identify key considerations during patient handover. So the ICEBA framework overview. So the ICEBA is an abbreviation of: I stands for introduction, who are you? Who are you calling about? S stands for situation, what's happening right now? B stands for the background relevant medical history. A stands for the assessment, and R stands for the recommendation. So the ICEBA framework transformation chaotic information sharing into structured professional communication. Introduction ensures proper identification, preventing wrong patient errors that occur in 1 in 1,000 hospital admissions. Situations provide immediate context, helping the receiving nurse prioritize care. Background offers essential medical history without overwhelming detail. Assessment shares current clinical status using objective data. Recommendation guide immediate actions and ongoing care priorities. Research from Johns Hopkins demonstrate that structured communication tools like ICEBA reduce adverse events by 30%. This isn't just about following protocols, it's about creating a safety net through systematic information sharing to protect our patients. So let's look at patient scenario. So let's call our client Mrs. J. So our patient's name is Mrs. J, who is 68 years old, a typical post-operative cardiac patient. And then so the procedure is post-operative day 1 coronary artery bypass graft. The current status is stable but requiring ongoing monitoring. Shift changes day over and into evening shift. And then my role, my day shift nurse providing handover. So Mrs. J represents a typical post-operative cardiac patient you'll encounter during, like frequently in your clinical practice. A complexity is 68 years old with multiple comorbidities following major cardiac surgery, requires careful attention during handover communication. Post-operative day 1 is critical because the patient transition from intensive monitoring to progressive care, making thorough communication essential. This scenario mirrors a real clinical situation where you will hand over patients with multiple systems requiring monitoring, complex medication regimes, and evolving care needs. Understanding Mrs. J case thoroughly will help you prioritize information, identify critical safety concerns, and communicating effectively with interdisciplinary team members during actual clinical rotation. So watch carefully as I demonstrate professional handover communication using Mrs. J's case. Notice how I begin with clear identification, establishing my credentials and their patient's details. Observe my systematic progression through each ICEBA component, maintaining professional tone when conveying urgency appropriately. Pay attention to how I prioritize information, leading with immediate concern with including relevant background efficiently. Notice my use of specific data rather than vague descriptions, and how I conclude with clear, actionable recommendations. This demonstration represents best practice standards you'll be expected to meet in the clinical settings. I'll model appropriate pace, clarity, professional language that ensures safe patient transition. So patient safety remains our priority during every handover communication. Post-operative cardiac patient like Mrs. J requires specific attention to medication timing because cardiac medications have narrow therapeutic windows and serious interaction potential. Wound monitoring prevents surgical site infections that affect 3% of cardiac surgery patients. Hemodynamic instability can develop rapidly in post-operative patients, making frequent assessment crucial. Pain management impacts recovery outcomes and patient satisfaction significantly. Activity restrictions prevent complications while promoting appropriate mobilization for optimal recovery. Remember, incomplete or unclear communication during handovers contribute to 80% of serious medical errors. Your thorough systematic approach using these safety priorities protocols protects patients and demonstrates professional nursing practice. Now you'll practice the handover using everything we've covered today. Apply the ICEBA framework systematically, focusing on Mrs. J, specific care needs and safety priorities. Remember to speak clearly and confidently. Your colleagues depend on accurate information for safe patient care. Include specific vital signs, medication details, and assessment findings rather than general statements. Don't rush through communication. Prevents errors and demonstrates professionalism. I'll observe your technique, noting strength and areas of improvement. This practice session prepares you for the actual clinical